Okay, so when you're a mouth breather, sometimes the roots of it also, it's more than that. You can have sleep disorders,
Mhm.
so which means if you're not breathing through your nose and you're breathing through your mouth, and your tongue could be blocking your airway, so you may not even be getting enough oxygen to your brain and vital organs, so that's one thing. That's one of the main things that we need to look into, besides the fact that your microbiome will shift and change, and potentially you can put yourself at the risk of more cavities. But the oxygen that the brain needs, the heart needs, or all these vital organs needs is very essential. And if you're not getting, if you have sleep apnea, that was the term that I'm looking at. One of the things that we're looking, are you a mouth breather? Because if you're a mouth breather, that puts you at a higher risk of having a sleep apnea, which means not like holding your breath while you're sleeping for even few seconds, and during that time you're not transferring enough oxygen to the vital organs. So then you may need surgery intervention, you may need devices, CPAP for instance, or some appliances, dental appliances that can help your tongue to be repositioned, or mouth taping. You can kind of tape your mouth so your mouth wouldn't be open, so you can breathe the right way. Does that make sense?
Makes perfect sense. But would it contribute to things like cavities or no?
Mouth breathing, 100%,
Yeah.
because
Oh, look.
dry mouth contributes to tight cavities. The pH level will change. Yes.
Oh, God. Gosh. And I suppose, perhaps, see, that's extremely worrying. I suppose if there's also not oxygen going to the brain, that's also going to lead to things like cognitive effects, memory, sleep,
Stroke.
emotional regulation.
Yeah, and stroke is another big one. So we take sleep apnea very seriously. So nowadays we are trying to, we're more conscious of looking at the shape of the palate, or whether a patient is a grinder or not. These are little signs and symptoms of patients that have sleep apnea, and it goes unnoticed. Then, we send them for a sleep study test for 1 night or 2 nights. And the sleep study test shows, hey, does the patient throughout the night as he or she's sleeping, holding his breath, does it snore? If so, what's the oxygen intake? All of that data is given to us. Now, it gets studied by a sleep doctor, and you're like, oh yeah, you're a moderate level or severe level or mild level of sleep apnea. If so, then you want to be treated, because heart attack and stroke it's one of the number 1 and number 2 risk for patients that have sleep apnea that they go unnoticed.
God, gosh. Well, that's frightening.